Hi everyone. Today we are together with our IVF specialist doctor Serkan Aydoğdu. Hi Serkan
Hello, how
Aydoğdu.
are you? Welcome again. Thank you for your nice invitation.
We are here to talk about IVF treatments and would like to start with what is IVF?
Okay, one of the best non-fertility treatment is in vitro fertilization and known as IVF. And IVF is a technique whereby the eggs are collecting from the ovaries and fertilized with the sperms in the lab. Then the embryos placed into the uterus, in shortly. And in IVF, four main steps. The first step is as initial evaluation for the couples. Then we start the IVF treatments on day 2 or on day 3 when the menstrual bleeding starts. Mm-hmm. And we are aiming to maximize the collection of the number of oocytes. In IVF treatments, we have four main steps. In the first step, where IVF treatment is started on day 2 or on day 3 with starting menstrual bleeding. Then we are following the patients in regular intervals for performing the sonography. We are following and checking the ovaries, the oocytes, for the number of the oocytes and also the size of the oocytes. And the aim of the treatment is to obtain sufficient number of the eggs, because for us it's very important for pick up the oocytes for creating the embryos. Then the second step, when the ovaries are the oocytes are come to the enough size, we are the second step means egg retrieval, egg collection. Mm-hmm. It is actually very easy procedures, and the patient is under slightly anesthesia, mm-hmm. and we are picking up the oocytes with the needle, which is through the vaginal sonography. And it takes about 20 minutes, about 20 minutes, and then the patient's short rest. It's mm-hmm. just enough for us. In the third step, the lab step is very important for us, because for the high quality embryos, at first we pick up the oocytes and we place in the incubator with the proprietary culture medium. Mm-hmm. Then a highly experienced our embryologist start to do ICSI. It's a very important point for us, because the ICSI is very general treatment technique. After the pick up the oocytes, our embryologist perform the ICSI, and then we check the 24 hours later for fertilization. The eggs looks at dividing into two cell embryos. Mm-hmm. And then we are following the embryos until day 3 or until day 5 in terms of the number of the embryos and the quality of the embryos. Because on day 2, when you look at the embryos, you should see the 2 cells. And one day later, on day 3, you should see dividing into 8 cells embryos, and then getting to teach with the cells, and they are making a blastocyst, and it means that we did our jobs very well. And the last step, embryo transfer. Embryo transfer is a very easy procedures, and it is similar like gynecologic examinations. At the end of the laboratory procedures, we are selected high quality embryos, and then we are placed into the uterine cavity, and we use a very fine catheter, and it's really painless for our patients.